Hi there, I'm Dave Dennis, Medical Services Officer with Tualatin Valley Fire and Rescue. I'm joined today by Dr. Daya.
Good afternoon.
We're going to talk to you about a change to the Etomidate and the tachycardia, unstable tachycardia protocol, kind of tied together.
And this was largely a clarification of language, building on last year's work.
Right. So last year we had introduced Etomidate as a sedation option for cardioversion, prior to cardioversion.
Correct.
There was some language in there that we had some question about, and so we started looking at a few different things. We looked at the speed of administration. So right now it says 30 to 60 seconds. We're going to push it over 30 to 60 seconds. And then how do we actually assess for when the patient's ready to be cardioverted? You know, how do we assess sedation on these patients?
And like everything else, when you introduce a new protocol, the first time that someone uses it, you learn very quickly that the protocol probably is not as precise as it should be. So that was what happened here, and we'll talk about a case that actually we had at TVFNR where one of our crews actually used Etomidate and had an experience, and as a result of this, we decided to go back and see could we make some tweaks to the protocol to make it a little bit more clear.
Right. And so just to review, this is how the current protocol, the 2017 protocol reads. And it talks about sedation should take effect in about 1 minute, but we didn't really define what to watch for or what to look for in these patients. And again, we had asked people to give it over 30 to 60 seconds. So let's just talk about that case. So we did have a case here where we had an elderly woman who was in a VTAC, as evidenced by the strip here. This is actually her strip.
And she was hypotensive and symptomatic and needed cardioversion.
So she was definitely unstable, so she required synchronized cardioversion. So the crew gave her 9 milligrams of Etomidate and pushed it over 30 to 60 seconds, just like the protocol states. Needless to say, she was not particularly happy after getting cardioverted. She recalled the whole event and basically told the crew that she wasn't too happy about it. And then, interesting enough, 5 minutes later, then she was asleep.
Correct.
If we look at a second case, this was a female patient who actually was in SVT requiring cardioversion. She was sedated with Etomidate, this time as IV push. They waited about 45 to 60 seconds until the patient actually became nonverbal. She was no longer responding to commands, and then she was cardioverted. She gained consciousness about 45 minutes after that with no recollection of the event, which is what we want.
Correct.
So we looked at that, we said, well, what was the difference between these two cases? Was it the speed of administration, the IV push versus the 30 to 60 second administration? Was it the waiting period, that 45 to 60 seconds, or was it both? And so there was a study that we looked at. If Dr. Daya, you want to talk about that?
Yeah, sure. So this is looking at the speed of injection on induction time of both propofol and Etomidate, two drugs used to induce anesthesia. So you can see the induction time on the left-hand side, which is, the speed of injection is 20, 40, and 80 seconds. And then you can see the time, the mean time to induction. And you can see with 20 seconds, which is about how long it takes you to usually push something, you can actually push it shorter. The mean onset is about 32 seconds for Etomidate, and it's true also for 40. So basically, based on that, I think that our decision was that you could go ahead and just basically give it push, and that should give you an induction onset within about 32 seconds.
So this is how the protocol will look here. And so we, like you said, we just change it to a push. So it's IV push to a maximum of 10 milligrams. And then the language as far as what we're looking for induction. It says wait 45 to 60 seconds for signs of sedation, such as the patient becoming verbally unresponsive or no longer following commands.
Correct. And actually in that same paper, one of the things they'd done was actually give the patient a paper cup. And as soon as the paper cup dropped from their hands, they knew the person was essentially ready for their anesthetic procedure, which was to intubate them. And so you can see that you can look at things, or you can actually have the patient hold a pen or a cup or something, and as soon as they drop it, you know that they're basically out and it's time to go into the rear shock.
Thanks for watching, and remember, these protocols will take effect on January 8th, 2018. Thanks for watching.
Thank you.